God of love, God of mercy, and God of all goodness, God of this creation. We present ourselves before you this day, this hour. That, Lord, as we engage in sharing, as we engage in discussions, that, Lord, our hearts, our minds would be soft, would be receptive and open to hearing from each other. We pray, Lord, that as information is shared, we'll hear more than just information, but we'll hear of purpose. We pray that as questions are asked, we will hear not just doubts and critiques, but we'll hear that longing for more and for better. And so be with us, go before us, and may we follow with humble and willing hearts. Bless our time together, and may we leave this discussion better informed, with increased understanding, to allow your will to be done. These mercies we pray and ask in the name of your Son, Jesus Christ our Lord. Amen.
Dear esteemed colleagues and special invited guests, welcome to this momentous occasion as we endeavor to consult with all stakeholders within the Federation of St. Kitts and Nevis and the National Vaccination Rollout Program that was commenced yesterday at the Newtown Health Center. However, before I continue, please allow me to recognize the presence of all who are sitting here with us this afternoon. May I commence by acknowledging the Honorable Attorney General, Mr. Vincent Byron Jr., Chair of the Mitigation Council, the Honorable Wendy Phipps, Co-Chair of the Mitigation Council, and at the head table we have the Honorable Aquila Byron Nisbet, Minister with responsibility for health et al. We also have at the head table Chief Medical Officer, Head of the Health Emergency Operations Center, and co-chair of the National COVID-19 Task Force, Dr. Hazel Laws. Accompanying Dr. Laws at the head table and the Honorable Minister is the Medical Chief of Staff, Dr. Cameron Wilkinson, who will be our first presenter. I also want to recognize the presence of Permanent Secretary within the Ministry of Foreign Affairs, Ms. Kebas, Permanent Secretary within the Ministry of Tourism, Ms. Carleen Henry Morton. And my understanding, if she's not here as yet, that the Permanent Secretary of the Ministry of Health may be on her way. I also wish to acknowledge the presence of the National COVID Task Force membership who are present here today. In the interest of time, my colleagues, I seek your permission not to have to mention each and every one of you. However, allow me to continue to acknowledge the presence of the Labor Commissioner from the Labor Department, Ms. Shernell James, accompanied by her colleague. Our special invited guests here present with us from the Chamber of Industry and Commerce, ably led by the first female president, Ms. Giselle Matthews, Vice President, Ms. Natalie Kelsey, and of course accompanied by Mr. Andrew Satney, Executive Director of the Chamber of Industry and Commerce. Over the past year, we have fostered a very important partnership with the members of the clergy, and I am very happy today that they have answered the call of being here as a stakeholder. The Christian Council and Evangelical Association, who are represented and led by the Chair of the Christian Council, Reverend Mark Christmas, and the President of the Evangelical Association, Pastor Leroy Matthew. A hearty thank you to you for answering the call. Equally so, I want And to acknowledge the presence of the representatives from the Trade and Labor Union, in that of Mr. Larry Vaughan and Precious Mills. Rotarians from the Rotary clubs who are here with us, my very good colleague, Canon P. Alistair Rollins, President of the Rotary Club St. Kitts, Denise Allen, President of the Rotary Club La Amigo, Dr. Dwayne Archibald, President-elect, and Leah Shadderton, Director of Public Image. The delegation present from the Ross University School of Medicine is led by Ms. Desiree McCoy, Operations Manager or Officer and Incident Commander. And thank you for allowing us to use your facility. May I also encourage everyone to social distance. So you will see at the seats that you will have a small indicator that says sit or don't sit. Please adhere to these indicators. To all, a hearty welcome. We are going to have a presentation done by both Dr. Laws and Dr. Wilkinson. This is the beginning of a series of consultation that will be ongoing until together we can reach the desired goal of reaching herd immunity through immunization. Our nation feels proud that to date we have had only 41 confirmed cases of COVID-19, no death, and no challenges to our healthcare system being overwhelmed. I must inform you that yes, we have 2 active cases that are recovering nicely. That I understand from the last report given by our CMO. When we look throughout the region, the progress of the vaccination roll-up programs have been impacted by vaccine hesitancy, reactive public awareness campaigns. The effects of not reaching our target are far-reaching and can further complicate our balanced approach to returning to a normalcy of that we experienced pre-COVID-19 pandemic times. I want to use the example of several countries that began before us and their present status. Case in point, in Antigua, the vaccination process would have begun on the 21st of February. Persons who received their first dose totaled 383, and the goal is to vaccinate 80,000 of their citizens and residents. To date, they have only had 872 registered. We must be sensitive to the fears and doubts in our society. That's why we are here today, so we can approach this initiative with a common goal, and this cannot be done without you. I have received calls personally from persons in the workforce asking, would their job be in jeopardy if they don't accept the vaccine? Would I have long-term symptoms? Should I have my last meal before taking it? Can I travel after I take it? Do we trust the place it was made? If I take it and I die, who is responsible for me, Mr. Samuel? I am a national by descent. Will I qualify? I am a work permit holder. Will I be included? These are some of the questions that we feel on a regular basis. Today, I am confident that Dr. Laws and Dr. Wilkinson will do an excellent yet wonderful job in educating and answering your questions. Please note that they are being accompanied by their boss. Let's be mindful for them as well that time is of the essence today, as they will have to be on leadership matters tonight as they continue their educational journey. The rest of this gathering will be as follows: presentation by Dr. Wilkinson, Dr. Laws, questions and answers, and again, let me apologize for not recognizing those who are joining us online. This meeting or gathering is being streamed live as we speak, and we will capture the questions that will come in, and these questions hopefully will be answered by our medical team. With that said, I think I've said enough. Thank you all, and I do look forward to a healthy and fruitful dialogue. Dr. Wilkinson?
Thank you very much, Mr. Samuels. Is the thing being projected? Yes? Okay. Thank you very much for coming. Before I start the slide presentation, it's important for me to put things into context. You would have heard the Prime Minister in one of his addresses mention that here in St. Kitts, we had a simple four-prong approach to the management of this virus, cognizant of the fact that the World Health Organization said there was no one-size-fits-all approach. And so while we were following the guidelines of the World Health Organization, every country had to cut their garments to the cloth that they had. And our approach was very simple. One, to keep the virus at bay as long as possible, and we were successful at doing that, in that the Federation of St. Kitts and Nevis was one of the last places on the face of the earth, outside of Antarctica, where the virus crossed its shores. Second, once the virus got to the Federation, our plan was to contain the virus, therefore limiting hospitalizations and deaths and avoiding community spread. And you know that we are one of the few places also that has 0 deaths, and the few hospitalizations we had were out of an abundance of caution. So we had no major hospitalizations and we had no community spread. The third leg of the journey was to make sure that we limit the time before the vaccine became available and community spread, knowing that community spread would be inevitable once the virus was circulating. And we wanted to make sure that that gap was as narrow as possible. And we were actually successful in that we started our vaccination program yesterday, and as yet we have no community spread, so that gap was 0. And the fourth and final leg of the journey is to make sure we attain herd immunity by immunizing persons in the Federation. We know that there are a lot of questions to be asked. We know that there is vaccine hesitancy out here, and we're hoping that through this discourse, we can address most of those issues. It's important for us to have a historical perspective, however, in that in 1760, more than 400,000 Europeans were dying each year from smallpox. And a rumor started that dairy workers, persons who were working with cows, were not dying from smallpox. And there's a surgeon by the name of Jenner who decided to listen to this rumor. And sometimes it's important for you to listen to rumors. And he decided to investigate it and realized that the farm workers who were working with the cows, they were previously infected with a virus that was similar to smallpox called cowpox, giving them minor symptoms. And because of that, they were protected. And with that information, he proceeded to inoculate children with the cowpox vaccine, making sure they were exposed to the cowpox vaccine, thereby stemming the tide of death. And so the first vaccinations basically started in 1760. So we are not reinventing the wheel when we speak about vaccinations to control disease. So what is a vaccination? It's a simple and safe and effective way of protecting people against harmful diseases before they come into contact with them. It uses your body's natural defenses to build resistance to specific infections and make your immune system stronger. And the vaccines train your immune system so that when you're exposed to the disease, you can mount a response against it almost immediately. The vaccines are safe in that they generally contain either a killed or attenuated or weakened form of the virus or germ, so that you don't necessarily develop any significant complications when they're given. And they are usually given either by injection, orally, or spray. in the nose. Now, as I look around this room here, I see some of my classmates from many years ago who didn't take their vaccination, not because they didn't believe in vaccination, but they were afraid of needles. And so sometimes persons choose not to have the vaccination just because of a fear of needle. I can tell you that I had my vaccination yesterday. I barely felt the injection. These needles are so small, etc. Now I see Leslie shaking his head too. Yeah, okay? And so even if you have a fear of needles, the needle is so small that you will not have any problems there. Now, why is it important to be vaccinated? Today, there are vaccines available to protect against at least 20 different diseases, including pertussis, tetanus, polio, and measles. And vaccines save up to 3 million lives each year. When we get vaccinated, we're not just protecting ourselves, but those around us, because it is not everyone who can take a vaccine. There are some persons, for example, the very young, babies, the very old and frail, who cannot take the vaccine, and they depend on us to get immunized so that we don't spread the germs to them. And so when you go and you roll your sleeve up and take this vaccination, you are not just doing good to yourself, but to the weaker ones among us, okay? When I say weaker in terms of immune system and their health conditions. Now, as I said, we're not reinventing the wheel because there are a number of diseases that we use vaccines against already. And some of them you recognize, they're cholera, diphtheria, hepatitis, polio, rabies, tetanus, etc. And the reason why vaccinations are important, imagine right now, okay, let's say in the United States, they have over 500,000 persons who are dead now from COVID-19. If there were not any vaccinations, imagine fighting COVID-19 in addition to fighting polio, mumps, measles, rubella. You can imagine the disruption in the entire world that would occur if we chose not to take the vaccinations. And so, despite that, I'm actually surprised when some persons choose not to take the vaccination. And it's important first to understand then what is the concept of herd immunity, because you keep hearing us speak about this all the time. When a person gets vaccinated against a disease, their risk of infection is reduced, so they are also less likely to transmit the virus or bacteria to others. As more people in the community get vaccinated, fewer people remain vulnerable, and therefore there's a less chance of the pathogen spreading from one person to the other. And so by increasing the number of persons in a community who are vaccinated, we basically decrease the risk of the virus spreading. So for example, if every person at our ports of entry were vaccinated, even if they came in contact with the tourist who is coming in with the virus, they're not going to take it home because there is a protection there at our borders. So herd immunity is the indirect protection from an infectious disease that happens when immunity develops in a population, either through vaccination or through previous infection. It's important for you to know, though, that when you have a disease that is highly infectious and deadly, you do not want to get herd immunity via infection. In the past, for example, chickenpox persons will have parties for children to come and get over it because it was thought that it's better for you to get it when you were a child as opposed to an adult. But, and that can work for a disease that is not highly lethal. But a disease like COVID-19, you have to get to herd immunity via immunization, not by infection, because too many persons will die, and the question is, who would we want to sacrifice on the altar? You, your mother, your father? No. Okay, so how many vaccines are there, and are we concerned about the speed at which they are being developed? Now, there are currently 60 COVID-19 vaccine trials going on, but there are just a few leading candidates that received emergency use authorization. And as a matter of fact, in the pre-clinical trial, that is in the animal models, there are over 200 trials going on right now. And basically, if we're starting with over 200 vaccine trials, and only about 5, 6, 7 of them are being used in human beings, you understand the stringent protocols and procedures that have to go in place before these vaccines get into persons' arms. And so we are assured that once a vaccine is given emergency use authorization, that it is essentially safe. And the World Health Organization works in collaboration with a number of other agencies to ensure that these vaccines, when they come on the market, they're safe. Prior to the COVID-19 vaccine, the last vaccine that was to be developed at record speed was the measles vaccine that took about 5 years. Now, because the powers that be realized that the only how we're going to get out of this pandemic is through a vaccine, they pumped billions of dollars into the development of the vaccine. And also with the advance in technology, that is why we saw the emergence of the vaccines within a year. But it was not because of any shortcuts. And it's important for you to know that a person is more likely to be seriously harmed by the disease than by a vaccine. And even if you survive disease, there is something now that's called long COVID, where persons continue to have chronic symptoms that can go on for years, because this disease just started last December. And so we don't even know how long this will continue, because the last paragraph is not written as yet on the disease. Now, so we spoke about the vaccines, and it's important for us to be aware of what are the common vaccines that are available. The two that came on board were the Pfizer-BioNTech and the Moderna, and these are mRNA vaccines. This is a technology that was never used before, because generally what we did in the past was to inject a killed or modified version of the virus into the person, and they will mount an immune response. However, every single protein in your body is coded for by some proteins that are called messenger RNA. And what this technology does, they inject the messenger RNA that codes for the spike protein into the human beings. And it directs the cells to produce the spike protein on your cells, and your body would identify that as a foreign COVID-19 virus cell and mount antibodies. And so the second time when you become infected with the virus, you will mount an immune response to get rid of it. And so that's the theory behind the Pfizer and the Moderna vaccines. And they have efficacies of over 95%, and they're given 21 and 28 days apart. The Pfizer-BioNTech is recommended for persons 16 years and older, and the Moderna for persons 18 years and older. The problem with these two vaccines is that they require ultra-cold storage. And once you have a vaccine that requires ultra-cold storage, it limits the ability for you to transport this vaccine. Because we're not just talking about immunizing first world countries. We're talking about immunizing persons all around the world. Because the World Health Organization recognizes, and you should too, that no one is safe until everyone is safe. And so we need to make sure that every single country on the face of the earth have access to the vaccine. So imagine you having to have a freezer that goes down to -70 to immunize somebody way out in the boondocks, even in Canada, okay, or in Africa, or in Sandy Point. It will create some challenges there, because the refrigerator temperature goes down to 2 to 6 degrees. And so you would need to have a special freezer for these. And so while these vaccines have good efficacy, they are not vaccines that would be available for the everyday person. Now, next we had the University of Oxford Astrazeneca Vaccine, and this is an inactivated adenovirus vaccine. And basically what it is, they got a cold vaccine, and they changed it, put the DNA material of the COVID-19 virus into this virus and inject it into you, and then you would mount an immune response when you become infected with the COVID-19 virus. It offers very good efficacy. The protection is between 70 to 90%. And it requires 2 doses that are given 12 weeks apart, and is indicated for persons over the age of 18. And it has been specifically studied in persons over the age of 65, and so it can be used for the elderly. The caveat with this, though, is that if you have somebody who is very old, and apologies for those persons in here who are over the age of 80, but this is just a medical definition. If you're over the age of 80 and frail and has multiple medical conditions, it is recommended that we consult your doctor before giving you the vaccination. Okay? And you can see it is stored at 2 to 6 degrees, which is refrigerator temperature, and it can be stored for up to 6 months. Now, the vaccine that we rolled out yesterday is the Astrazeneca vaccine. And what you have to understand that a number of these biotechnological companies have a number of different places where they either source products or manufacture their vaccines. And so, although the vaccine was developed at Oxford University, they have a manufacturing site in India. And the site that they use is the Serum Institute of India. Now, the Serum Institute of India has been in existence since 1966, and it is responsible for more than 65% of the vaccines that are produced globally, including the ones that we know about, mumps, measles, rubella, etc. It's also thought that more than 2/3 of the children of this world would have received vaccines from the Serum Institute of India. And so when you went to school and the nurses showed up with their little kits and gave you the jab in the arm, you were actually getting vaccines that were most likely produced from the Serum Institute of India. And this is a highly reputable company, and it is authorized by the World Health Organization. And the World Health Organization is actually using the Astrazeneca vaccine manufactured at the Serum Institute of India for their COVAX program to get mass vaccination throughout the world. And so when you hear people saying, oh, it was made in India, well, you would prefer it was made in Mother England? I mean, what is the difference? It is the same chemical process that is involved. And so that's a very myopic, colonialistic view of looking at the vaccine, okay? And so we have to understand that the Serum Institute of India, it is the world's largest producer of vaccine. It produces more than 1.6 billion doses of vaccines that are distributed throughout the world. And so there is no other institution on the face of the earth that produces and exports to places all around the world more than the Serum Institute of India. Moving on. Now, there is a lot of hope for the Johnson & Johnson vaccine, and I'll tell you some more about this. Okay, this has not been given emergency use authorization as yet, but it's thought to be effective against the new variants compared to other vaccines. And it does not require any special ultra storage to keep it. It can be stored in the refrigerator for up to 3 months. And the effectiveness is about 66% overall. The good thing about the Johnson & Johnson vaccine is that it has a great effect in terms of limiting hospitalization and death to up to 85%, and it only requires 1 shot. And so everybody, for example, who got their shot yesterday, who got their shots today, they would have to come back in 10 weeks. If you have a vaccine that requires just 1 shot, then you know that the person is complete. And so there's a lot of hope resting on this if it gets emergency use authorization for rollout in a number of other third world countries to ensure that people get vaccinated in a very efficient way. Now, this brings me to vaccine efficiency, because there are some persons who will look at the Pfizer vaccine and say, well, okay, it is 95% effective. And we said that the AstraZeneca vaccine is 83.4% effective. So they will say, I want to get the Pfizer, which is 95% effective. Vaccine efficacy is the percentage reduction in disease incidence in a vaccinated group compared to the unvaccinated group in clinical trials. Okay, and so the figures when we speak about the vaccine efficacy, we are talking about what the results showed in the clinical trials. Now, many clinical trials have what's called exclusion criteria, because when you're testing a vaccine, you want to make sure that you do the test in persons who are relatively healthy. And so they would exclude young children. And that is why, for example, these vaccines are not indicated for persons below the age of 16 or 18. It is not that, it is thought now that they would be harmful to these persons, but the initial tests were not carried out in these persons. They carried them out in persons who were older and healthier. And so the exclusion criteria are usually age, pregnancy, or particular health conditions, because you're not going to go and test a vaccine in somebody who is 85 with serious heart problems, kidney problems, etc. Because just by getting a fever, you can tip the person over the edge. Now, the ideal conditions of a clinical trial do not reflect what happens in the real world. And you could have seen that, for example, in the vaccine rollout we had yesterday. We have persons there of different size, shape, age, etc. Okay? And so this brings us to vaccine effectiveness. And the vaccine effectiveness tells us how well a vaccine works under real-world conditions once people are outside of the clinical trials. And how effective the vaccine will be will also depend on how many persons who are covered. Now, there are a number of other things that will affect the effectiveness of vaccine. It depends on the age, whether or not the person has major illnesses, previous exposure, the time since vaccination, etc. And of course, we've all heard about variants and the development of new variants. And so it's important also for us to know what is a variant, and are we surprised about the development of variants. Now, when a virus makes copies of itself, it sometimes changes a little. And when I say that, when you become infected with the virus, it makes other little viruses, and that's how you become sick, because the virus is actually multiplying within you. And once the virus is circulating, the virus will have a number of different changes until eventually you might have a dominant strain that develops, which is called a variant. Now, the reason why the virus does this, because the virus wants to be able to adapt to its environment. And so the variants either have a change in transmissibility, which means an increase in the way the virus spreads, or increasing the severity of transmission. Now, initially, a number of these variants were shown to have an increased transmissibility, but not an increase in severity of the disease. But even if a virus had increased transmissibility, that can lead to an overwhelming of your health system, because if more persons are coming down with illnesses, then it means more persons will be presenting to the hospital. And so they go hand in hand. We learned about the new variants, the UK, the South African, and the Brazilian variant, and that is why we issued the advisories about travel from these places. Now, again, making the point about vaccine efficacy, it's important for you to know that very few vaccines reach 100% efficacy. For example, the flu vaccine varies from efficacy from as low as 10% in 2004 to as high as 60% in 2010. And generally, the efficacy of the flu vaccine is between 40 to 60%. Yet, millions of persons take it every year, and millions of lives are saved each year by taking the flu vaccine. So one doesn't necessarily have to reach an efficacy of 100% for the flu vaccine to be effective. Last year, there are a number of persons, I'm pretty certain some persons in this room took the flu vaccine, not realizing that the efficacy last year was 45%, okay? And we are saying that the Astrazeneca vaccine is over 80%. Now, if we look at some of the vaccines that we have taken, you know, you see the measles, mumps, rubella, the efficacy against measles, 93%, mumps, 78%, and rubella, 97%. And after the second dose, the mumps vaccine efficacy jumps to 88%, never crossing 90%. But we have eliminated mumps here in St. Kitts and across the globe. And so you don't necessarily have to have an efficacy of over 90% for you to eliminate a disease. It depends on the number of persons who are taking the vaccine. So there are very few vaccines that reach close to 100% efficacy. Now, so the question is asked, who will be vaccinated first? And the World Health Organization provided guidelines for determining who are vaccinated first. But it's important for us to remember, again, we said that there was no one-size-fits-all. And so the approach from the World Health Organization was based on a number of goals. And I'll tell you what these goals were. Number one, one second. Yeah. The first was to decrease death and serious disease as much as possible. Second was to preserve function in society. And so for you to preserve function in society, you need to make sure that essential workers are immunized. And the last goal was to reduce the extra burden COVID-19 is having on people already facing disparities. So we're talking about the underprivileged, because the underprivileged who are living in overcrowding conditions, they will more likely have the virus spreading rampant in their community than you who are living in a house where you have to make a cell phone call to call your child from the kitchen. Okay? So the phased rollout guidelines from the World Health Organization, they spoke about healthcare personnel and persons in long-term care facility. But you will see our program, when the CMO speaks about it, will be slightly different, because since we do not have community spread, we don't have to go into the carrying home and start immunizing those persons. We will be focusing on showing up our borders, the persons who are more likely to be exposed to the virus if the virus comes into our country. The next would be frontline essential workers and people 75 years and older, because these are more likely to suffer from hospitalization and disease. And the third would be people between the age of 64 and 74, and also those between the age of 16 or 18 and 64 with underlying conditions. Now, the ultimate goal really is to have everyone immunized. But we need to understand that while we work towards rolling out a safe and effective vaccine program, we must continue the essential public health actions to suppress transmission and decrease mortality. Now, some persons ask, should the vaccine be mandatory? And I'm glad that we have the Attorney General here. To be properly protective, COVID-19 vaccine needs to be given to most persons, if not everyone. It is only through widespread vaccination we will reach herd immunity. And so you understand persons have a personal responsibility to take this. And that's one of the reasons why we are having these sessions, so we can allay any doubts. Being vaccinated, we know, dramatically reduces the risk of seriously harming or killing others. So you're not just protecting yourself, but you're protecting others. And one of the things that I say all the time is this: if I were to take a gun and shoot someone, you will see the direct effect of my action right there. The person drops down, okay? But you breach quarantine and go and spread the virus, okay, at a nightclub or a bar. It's 2 weeks later, the effects would be occurring from your action, and you will be long removed from the incident. But you're just as guilty as the person who took a gun and shot someone. And so that is why it's important for us to understand that we're all in this fight together, and every single thing we do will help us to get out of this. Now, and the benefits then of being vaccinated will come at a minimal cost or zero cost, because the vaccine is free here, okay? And it will come at a significant cost to, minimal cost to society, because it is only through the vaccine that we can open up. Now, persons have to understand, though, however, that if you don't do this and we have community spread, we will have to have a lockdown, and lockdowns are mandatory, and they come at significant individual costs and social costs. And so when you are vacillating as to whether or not you should take the vaccine, you have to think about, will I prefer a mandatory lockdown, or will I voluntarily move forward and get the vaccine to make sure that we can get back to some sense of normalcy? And so we believe that we can achieve herd immunity through less restrictive alternatives, and it's important for us to have this campaign then, and we're hoping that you can be messengers. So we finish educating and giving you the information here, and you go out to make sure that more persons take the information out. Now, another question that is asked is, if I get the vaccine and travel to St. Kitts, will I still need to quarantine? Now, it's important for you to understand that if you get vaccinated, you may still transmit the virus, because while you're mounting your response, you can still be multiplying virus in your nostrils, and you can cough or sneeze and spread it to someone. The good news about Astrazeneca is that it has shown now to decrease the incidence of viral transmission, which means that, and studies have shown that after the first shot of the Astrazeneca vaccine, your risk of transmitting the virus to someone else decreases by 67%. So you can see the vaccine we have has a great potential, once we achieve herd immunity, for us to even look at lessening some of our restrictive protocols for entry and moving around in the country. And so everything, again, in terms of us getting back to some sense of normalcy, depend on you. Some persons also ask is, if I had COVID-19 infection already, do I still need to be vaccinated? And the guideline is that the vaccine should be offered regardless as to whether or not you had COVID-19 infection. However, it is advised that if you're currently infected, you should wait until you recover. We also know that persons who were previously infected, they have some degree of immunity for up to 90 days after. And so if we're in a situation where vaccinations are limited, you will put the persons who were previously infected a little bit on the back of the line and vaccinate those who are basically virgin territory. Another question that is asked is it recommended for pregnant women? Now, pregnant women who contract the virus, they have an increased risk of poor outcome. And the World Health Organization advises that those who are at risk of contracting the virus through work or having underlying health conditions which predispose them to developing complications should take the vaccine. What we are recommending here in the Federation is that we would not routinely give the vaccine to pregnant women. And so if you have a pregnant person who is working at your establishment and they're at increased risk because they're working at the port, they're cashing and coming into contact with a number of other persons, it is recommended that you move them into a protective place in your job site, working in the back, you know, behind the computer, away from someone, so that they would not be at increased risk for developing any COVID-19 infection. Now, I'm coming to the end, and the question is sometimes asked, how quickly will this vaccine end the pandemic? And the impact of COVID-19 vaccines on the pandemic will depend on several factors. And these include the effectiveness of the vaccine, and we know that we have a very effective vaccine that we are rolling out here in the Federation of St. Kitts and Nevis. It all depends on how quickly other vaccines are approved and delivered into the arms of the public. And so we're not just talking about us here, because we're not safe until our neighbors are safe. And so the more effective vaccines that come on board and make sure that the entire world is vaccinated, then the safer we will be. And also, how many people get vaccinated, and this comes down again to the individual. And this is the first time in our history that the singular action of an individual can have far-reaching consequences for all of us. And so we encourage you to speak to everyone and make sure that we push towards mass vaccination, because we know that vaccines saved lives, and complacency and inaction is just as deadly as the virus itself. Okay? And so I thank you for listening.
Thank you, Dr. Wilkinson. And then we will have Dr. Laws, so please save your questions. So as soon as Dr. Laws finishes, we will go into the question and answer, and then we will have, you always save the best for last, and then we will have the minister give her a few words to you. Dr. Laws.
Thank you, Mr. Chair, and a warm good afternoon to everyone. I should be okay. Oh, all right, so this afternoon, in my presentation, I will seek to accomplish 3 objectives. 1, I'm going to provide you an overview of the present COVID-19 status. And then secondly, I'm going to provide you an overview of the St. Kitts and Nevis National COVID-19 Vaccination Deployment and Implementation Plan. And then thirdly, I'm going to just add some more information regarding the COVID-19 vaccine. And so, ladies and gentlemen, at present, over 111.4 million persons have been confirmed with this disease globally. Over 2.5 million persons have died. And so this is based on the World Health Organization's COVID-19 dashboard. In the United States of America, over 28 million persons have been confirmed with COVID-19. And guess what? The death toll has passed 500,000. Within the CARICOM member states, over 106,000 persons have been confirmed, and collectively over 1,870 deaths have been reported. In the wider Caribbean region, the number of confirmed cases have exceeded 500,000, and the death toll in the region, in the Caribbean region that is, has exceeded 7,500. Now, what's happening in the Eastern Caribbean states? In Barbados, over 2,772 persons have been diagnosed with COVID-19, and the number of deaths, 31. In St. Lucia, 3,135. The death toll as a result of COVID, 32. In St. Vincent and the Grenadines, 1,505 persons diagnosed, 6 deaths. Antigua and Barbuda, 614 confirmed cases, 14 deaths. And then you can look at the other islands. Now, within the Federation of St. Kitts and Nevis, Mr. Samuel said we had 41 confirmed cases. But ladies and gentlemen, 40 of these cases have recovered. And so at present, we only have 1 active case. That individual remains in isolation, stable, and is being monitored. So, in terms of providing you an overview of our national COVID-19 vaccination plan, I'm going to describe how we are seeking to access enough vaccines to vaccinate our population. I'm going to describe distribution, and we're going to look at acceptance. Now, on February the 11th, the Federation would have received a generous gift from Dominica. We received 2,000 doses of the Astrazeneca Oxford vaccine. In terms of the COVAX facility, you are well aware that we have signed on to this global mechanism through which we hope to procure over 21,600 doses of the Astrazeneca Oxford vaccine. The specific date when we will be receiving same, we are still not absolutely sure. We are awaiting that bit of information. Now, the Federation is also seeking to access COVID-19 vaccines through at least 2 other mechanisms. Please note, access to the COVID-19 vaccine is crucial to curbing the spread of COVID-19 infections. In terms of distribution, most of our vaccines nationally are stored at our central medical stores located at the JNF General Hospital. And so in that unit, we are expanding our storage capacity. So we are procuring enough refrigerators to make sure that we have adequate storage capabilities there. And I must say the same for Alexandra Hospital in Nevis. And so the plan is vaccines will be transferred from these central points to the health centers around both islands. 11 health centers St. Kitts, 6 health centers in Nevis. And so, ladies and gentlemen, the health centers are the designated COVID-19 vaccination sites. And so yesterday, we started our program at the Newtown Health Center. And so for this week, the vaccines will be administered in 7 of the 17 health centers, 4 in St. Kitts, 3 in Nevis. And so the 4 in St. Kitts, Newtown Health Center, Basdale Health Center, Sandy Point, and Tabernacle. In Nevis, Charlestown Health Center, Gingerland Health Center, and Combermere Health Center. By next week, the additional 10 health centers will come on board. And so, ladies and gentlemen, if you have decided that you are ready to take the AstraZeneca Oxford vaccine, all you have to do is go to the nearest health center and make an appointment. Or you can call 311, and then within 24 to 48 hours, you will receive a call back with your date and time for your appointment to receive your vaccine. Now, in terms of prioritization, as I said before, we've received only 2,000 doses for the Federation, and so we have to prioritize. And so we are rolling out our program in 3 stages. In stage 1, there are at least 4 priority groups of persons that we will be targeting. We'll be targeting healthcare workers who are at high to very high risk of exposure to the COVID-19 virus. And these include all specialists, internists, doctors and nurses working on the COVID wards in St. Kitts and Nevis, those working in the operating theater, those working in the intensive care unit, accident and emergency, all private practitioners. They are operating on the front line. We also will be targeting COVID-19 testers, meaning the public health team who move around to all the hotels and quarantine sites to take samples. They are on the front line. This group also includes health center nurse managers and personnel working on our ambulances. We are also going to target the frontline workers working along the corridor of containment. And these include port health workers, immigration, customs workers, persons working in terms of ground and sea transportation. So that includes our taxi drivers and those on our ferries and sea taxis. Hotel workers on the front line, those working at the front desk, security, lobby, housekeeping, food and beverage. We will also be targeting the executive arm of government and essential workers outside of the health sector, and these include police and defense force, Coast Guard, fire and rescue. We are also targeting older adults, persons between 60 to 80 years of age with multimorbidity, meaning more than 2 or more chronic diseases. And these illnesses can include diabetes, respiratory conditions like emphysema and asthma, renal disease, and autoimmune conditions. During stage 2, we will be targeting the following priority groups: healthcare workers who are at moderate to high risk of exposure to the virus. These are the healthcare workers working on the other wards, the medical ward, surgical ward, maternity, pediatrics, OBGYN, even the psychiatry unit. Staff in nursing homes and in home care services, and other staff members working in our hospitals, including our lab staff, pharmacy staff, staff in the X-ray department, and mental health, the treatment center. We are also targeting older adults with 1 or less chronic illnesses, meaning persons between 60 to 80 who are diagnosed with chronic illnesses and who are free from chronic illnesses, but just by age alone puts you at risk for moderate to severe disease of COVID-19. Please note that age 80 is not a cut point. In other words, persons 80 years and over can be vaccinated. However, it's out of an abundance of precaution that we are asking such individuals to be evaluated by their physicians and then have their primary care physician make a recommendation regarding their suitability for receiving the vaccine. In stage 2, we will be targeting persons who are in the middle age group, meaning those under 60 with chronic diseases. And then we will also target the socioeconomic groups, including low-income migrant settlements in St. Kitts and Nevis, disadvantaged persons registered in the Social Security benefit systems, persons with disabilities, persons in low-income groups, hard-to-reach populations, and persons with mental health conditions. In stage 3, or phase 3 of our rollout, we will be targeting all the staff members working in the Ministry of Education, those in the education sector, from the early childhood level up to the tertiary institution. In this stage, we will be targeting essential workers outside of the health sector, which includes police, defense force, municipal services like other civil servants, persons working in agriculture, food industry, ground and sea transportation, and then the social employment groups, and then the healthcare workers who are at the back end, meaning those that are not on the front line. And then everybody else in society falls into the third stage. So this would include young adults and middle-aged adults who are healthy without any chronic diseases. Now, we will be utilizing an appointment system. And as I said before, if you have decided that you are interested in receiving the vaccine, you just need to make an appointment. That's easy. Make contact with your nearest health center or call 311 and you will be given an appointment. You will receive your first dose and then you will be given a 10-week appointment to return for your second dose. When you receive your first dose, you are going to get or receive a vaccination record card indicating the date and all the particulars of the first dose. And then the same thing will happen when you receive your second dose. And upon receiving your second dose, your card will be stamped and then it will be official. Now, the Ministry of Health, we are in the process of developing a database, a registry of persons to be vaccinated. And we are also going to develop a database whereby we will be capturing data from vaccine safety surveillance. So today already, I would have made a call to most of the 70 individuals who we would have vaccinated yesterday. And I'm going to share some of the information I would have gleaned between this morning and present. In terms of vaccine acceptance, the Ministry of Health, we have developed a very comprehensive communication strategy and plan whereby we will be educating the general public, providing you with all the pertinent information regarding the vaccine that we will be offering. We'll be using traditional media, radio, television, and digital media. And so the information is well packaged and will be disseminated using WhatsApp, Facebook, Instagram, TikTok, you name it. And then, please note, stakeholder meetings. And so we are going to be hosting meetings similar to this. And so we are asking our key stakeholders to reach out to the Ministry of Health, our communications arm, meaning the Health Promotion Unit, through 311. So you just have to make a call to 311 and you will, your presentation or your stakeholder meeting will be planned and organized. Ladies and gentlemen, the goal is for everyone to be able to easily get a COVID-19 vaccine. People most at risk will be prioritized. However, while we work towards rolling out a safe and effective vaccine fairly, we must continue the essential public health actions to suppress transmission and reduce mortality. And these include active surveillance. And so the Ministry of Health, we are actively seeking out persons who present with flu-like symptoms, and we are testing them. And we continue to explain to the public why we must continue the prevention and control measures. Now, a little bit more about the Astrazeneca Oxford vaccine, because Dr. Wilkinson would have explained quite a bit. This vaccine it's a biological preparation, and it's made from the actual adenovirus, not the coronavirus, an adenovirus that's attenuated or altered. It was, taken from the chimpanzee. It was altered, And so this biological preparation is injected into you. You are given a 0.5 ml intramuscular injection, your left or your right arm. And yesterday, most persons who received this vaccine, they were asked to remain at the health center seated for at least 15 minutes afterwards, such that they can be monitored for any side effects, untoward side effects. Please note that this vaccine was achieved WHO emergency use listing on February the 15th. So it has been approved. Dr. Wilkinson would have walked you through the efficacy. So the efficacy against symptomatic COVID-19 from this vaccine ranges between 70 to 90%. You would have heard, or you know by now, that persons 18 to 80 years, that's the target group that we are catering to. So these are the persons that we are targeting to vaccinate. And also persons in this age group with chronic conditions. Now, in terms of those of you who are considering this vaccine, please note, if perchance you are experiencing a fever, or you are, sick, have the cold, and you are having a fever, you really should postpone your vaccination date until you've gotten over your fever. It is currently recommended that the same products be used for both doses. So, for example, if yesterday you received the Astrazeneca Oxford vaccine, you will be told to come back in 10 weeks for your second dose. So let's say you travel to Miami and your appointment for the second dose is upon you. You cannot really go and get the Pfizer, BioNTech, or Moderna. It has to be the Astrazeneca Oxford. So you should receive 2 doses. Your first and second dose should be the Astrazeneca Oxford vaccine. Now, the available scientific data on the Astrazeneca Oxford vaccination of pregnant women is really insufficient to assess vaccine-associated risks in pregnancy. And so we are advising our pregnant females not to take the vaccine at this time. Now, vaccine efficacy is expected to be similar in lactating women as in older adults. It's unknown if this vaccine is excreted in human milk. As the vaccine is a non-replicating vaccine, it is unlikely to pose a risk to breastfeeding children. And so, in other words, if you are breastfeeding, it seems relatively safe for you to accept this vaccine. Now, based on the data and the science, these are the common or the most common post-vaccine symptoms to date. So persons who receive this vaccine may complain of pain, tenderness at the injection site, general feeling of being unwell, feeling feverish, having a headache, joint or muscle pain, and probably a loss or reduction in appetite. Now, yesterday, as I said before, about 70 persons received this vaccine at the Newtown Health Center. And so when I woke up this morning, I started making calls to persons who would have received the same. Quite a bit of persons said, "I'm fine. Did you really give me something yesterday?" Others complained of tenderness or pain at the injection site. Some said they felt cold last night. I think about 2 or 3 persons complained of experiencing chills. About 4 or 5 said, "Hey, I had a mild fever, but I took 2 paracetamol tablets and I was fine." Some complained of a little feeling of fatigue or malaise this morning. Some said, "I just have some body aches and pains." One particular person said, "I'm experiencing mild headache." And I think most or all the persons who were vaccinated yesterday, they all came out or went to work this morning. So that just gives you an overview of the post-vaccination symptoms being experienced by our own people who were vaccinated yesterday. Now this slide, you must be fed up of seeing this slide, but I have to show it because we must continue our prevention measures of wearing our face mask, maintaining hand hygiene, and making sure we are, as we are, appropriately distanced from each other when in an enclosed space, and avoiding crowds as much as we possibly can. Ladies and gentlemen, we must continue these measures until we would have achieved a herd immunity threshold. If you don't remember anything else, this is the takeaway slide. Which will you choose? That's what it's come down to. As individuals, what would you choose? Are you going to choose the virus, or are you going to choose to take the vaccine? And in our case, the Astrazeneca Oxford vaccine. Well, the science tells us over 111.4 million persons have been diagnosed with this disease, and over 2.5 persons have already died. The science tells us that over 173 million persons have already received this vaccine, this particular one, the Astrazeneca Oxford vaccine, without significant side effects and 0 proven vaccine-related deaths. Ladies and gentlemen, I, Hazel Loretta Laws, will make a personal decision to take this vaccine. I haven't taken it as yet. I have an appointment next week, Wednesday, the 3rd of March, when the EPI manager will give me my jab. It's an international recommendation that when you are vaccinating essential workers, it's recommended that you not vaccinate everybody all at once. You must stagger the vaccination dates. And so last week, Dr. Cameron Wilkinson and I, we had a discussion from last week when we discussed, hey, who would go first? So he opted to go first. He's not afraid of needles, so he's front in line, all right? And so I will follow shortly with my vaccine. And so, yes, I will choose the Oxford AstraZeneca vaccine. Ladies and gentlemen, don't hesitate, vaccinate. A vaccination ensures a healthy nation. If you choose to be vaccinated, you're not only protecting yourself, you're protecting your family, your loved ones, you're protecting your community, and by extension, our federation. Thank you.
We will just have a short words by the minister, and as soon as the minister finishes, then we will engage in the question and answers.
Thank you very much, Abdias. Allow me to adopt the protocol and recognize my cabinet colleagues, the Honorable Attorney General and Minister Wendy Phipps. I am so thankful that the NEOC organized this meeting. I know many of you have been reaching out to Abdias. Abdias' phone rings non-stop, and Abdias insisted we have to come and talk to you to give you some information about the vaccine. And so that is why the team is here today. But I also want to recognize when the CMO spoke, she spoke of the fact that we would have a number of sessions, be it personal sessions with different groups, church groups, community groups, etc. And we're doing this in a phased approach, just as the phased approach that we have been using for the rollout. So phase 1, frontline workers and the persons along the corridor of containment. That's the same approach we're going to take in terms of our education program. And so with us today as well are members of that education team who are sitting on my right, and I'll ask them to just stand so that persons can be familiar with them. Dr. Sebastian, Dr. Archibald, and Dr. Ufre, who will be assisting both the CMO and the medical chief of staff in educating persons about the COVID-19 vaccine and making sure you get all of your answers, your questions answers. Thank you so much, doctors. And so the Ministry of Health, and in particular the National Immunization Committee, have been working assiduously to ensure that we have a robust plan of action for the rollout of the COVID-19 vaccine. This committee comprises persons from the Ministries of Health, both on St. Kitts and Nevis, because we understand that it is a federal response required in order for us to be successful. The education arm of that team also comprises of persons from both the Ministries of Health on St. Kitts and on Nevis. The first action plan was for us to make the announcement, which was done on Sunday, the launch, which was done yesterday. Today, we are here with you. This evening, the doctors, as well as the Permanent Secretary for Health, will join the Prime Minister on leadership matters. Thereafter, you'll be seeing more from our doctors in terms of being able to meet with the various groups to ensure that persons have all the information that they need in order to make an informed decision as to whether or not you wish to take the vaccine. Apart from that, on the COVID-19 website, that's covid19.gov.kn, we've already posted a number of FAQs, frequently asked questions about the vaccine, so persons can log on to the COVID-19 website and get that information. Both the health promotion units on St. Kitts and Nevis have posted the brochures concerning information as well about the vaccine. So we want to make sure that persons have all of the information that they need, hopefully to be able to answer all of your questions. And so if you go onto the website, visit one of our health promotion pages, you will see the brochures, you will have your FAQs. If you still have questions, if you still want to meet with someone, as the CMO would have indicated, you simply call 311 and we will be able to make an appointment for your group to be able to have a session, a one-on-one session with one of our doctors who will be able to give you more information. And so I'm thankful for us to have this opportunity this afternoon to get the ball rolling, and we're looking forward to more and more uptake. As a matter of fact, before I left the office this afternoon, I was told by the 311 operators that already we have, through 311, over 160 persons who have already stepped forward and said that they are ready to be vaccinated. I'm still waiting for the numbers from the various health centers. And I know I've been sent pictures from persons who have had their appointment today and have already been vaccinated as well. And so we are happy that persons are stepping forward, and we want to see more of that, because we're not safe until everyone is safe, and we won't be able to accomplish herd immunity until everyone steps forward and take the vaccine. As you've heard from our medical chief of staff and the chief medical officer, it's safe. We have been following this for quite some time. I know I've sat in quite a number of meetings with the CMO discussing the various vaccines, the procedures, what's next from beginning right to this point when we are now ready to vaccinate. And so I'm hopeful that your questions this afternoon will be answered, and if it's not, that you will still seek more information and clarification, and I'm sure that one of our doctors will be more than willing to give you the information that you require. So I thank everyone for being here today, and I look forward to the questions that are going to be asked. Thanks.
Thank you very much, Minister. So we have 2 mics where persons can go to the mics and ask questions. So feel free to walk to the mics and ask questions, please. Sorry, just indicate who you are, please.
P. Alistair Rollins.
Okay, and we would allow 2 questions per person, and then we move on to
I have 1.5. The half is, does the 311 number applies to Nevis as well as St. Kitts?
Yes, it does.
Thank you. The one question. Now, Dr. Laws indicated that we are uncertain as to when we will get the vaccines from COVAX. Now, we have only 2,000 at this point. So if, as we expect, that people will come in droves to take this vaccine, what would happen if in 10 weeks' time we have not received the vaccine from COVAX and the second jab is due?
All right, so very good question, Reverend. And we will vaccinate up to 1,000 persons because 2,000 doses equals 1,000 persons. And our hope is that we will access vaccines through one of the other two mechanisms even ahead of receiving our allotment from the COVAX facility.
And just to add to that, although Dr. Law said we don't know when, we expect the timeline to be way under 10 weeks. And so we are hoping that very soon we'll be rolling out more of the vaccinations.
I think I can add as well that we are hopeful actually to receive one of our donations by Friday of this week. And so we should be able to have at least 20,000 by Friday of this week. That is through a donation, and the OECS Secretariat is organizing the transport of those vaccines into the OECS region. We are expecting an email by today from the COVAX facility with the timeline for the vaccine. So as soon as we get that information, we will also share that with everyone so everybody is informed.
Good afternoon. My name is Marshall Smith Anthony, Ross University. Dr. Laws alluded to the fact that the Astrazeneca Covishield vaccine decreases viral transmission. I was wondering, will this impact quarantine for persons who have been vaccinated? Or transmissibility, rather? Will it impact quarantine if you travel and have to come back to St. Kitts? Will it impact quarantine?
Okay, so that's a very good question and a very common question that we are receiving. And regrettably, the answer to that is we will continue quarantine. So let me explain, all right? So if I were to receive 2 doses of the AstraZeneca Oxford vaccine, yes, it would reduce my risk of, exposure to and even contracting the virus. However, I can still pick up the virus, and I may be able to spread the virus to other persons. And because of these 2, possibilities, individuals who are coming into the Federation from high-risk spots, hotspots, it's best for you to be quarantined for the 2 weeks in order to prevent clusters and community transmission in our federation.
And just to add to that, we've said all along our primary focus is the safety and security of the people of this nation. And until we get to herd immunity, where most persons are protected, the protocols and the procedures can't change. And so a change in the protocols is actually in your hands by you taking the vaccine and making sure that we can get to herd immunity.
So in other words, if we really want persons to buy in to taking this vaccine, as many persons as possible, because if we were to achieve our herd immunity threshold, about 75%, 80% of our persons, then and only then, when you travel and return, we can relax the health and travel protocols and probably reduce the quarantine time. So this is more reason for individuals to consider taking the vaccine.
Yes. All right.
May I? Good afternoon to all. Reverend Dwayne Cassius. 2 questions. As it relates to the, Dr. Wilkinson, you mentioned about the mRNA. Can you maybe say a bit more, especially in terms of the relationship between the mRNA and DNA? I'm hearing things like genetic alterations and stuff. So if you could just elaborate a bit on the relationship there. And then my other question would be, as it relates to, I call it quality control. In other words, when you have these mass productions and all the rest of it, do we have any way of ensuring the vaccines we're getting, that they are of the quality, that the producers claim that they are? Can we do any kind of random testing, or anything to just to check quality? Because with mass productions and so on, you always have some kind of little glitch and so on that would take place. So so those are my two.
Okay, I got you. Okay, so the genes that we have, we have two types of nucleic acids. One that's called DNA, short for deoxyribonucleic acid, and RNA ribonucleic acid. That's a bit above the grade that we're discussing here, though. The DNA is actually in the nucleus of the cell, where most of the machinery takes place, and the RNA is in the cytoplasm outside of the nucleus. Now, the Pfizer and the Moderna vaccine, they are using RNA technology, not DNA technology, and so there is no way it will affect your DNA and change your system. Okay, it's not DNA. We're using RNA, which is in the cytoplasm. And the way it works, the RNA is injected, covered by a nanoparticle, a particle. And once it gets in, and it gives the cells the instructions to make the spike protein, that RNA is destroyed. And so it doesn't stay in your system. And then when you're exposed to the virus a second time, you can mount a response. And so there is no risk at all of any change in your DNA or RNA. Okay, so they are totally safe. Now, as it relates to the vaccine safety, I think it's important for me to go through briefly what's involved in a vaccine coming to market. Because I said before, you have over 200 trials and only a handful that are in the arms of persons. And clinical trials go through, a number of stages. First, you have the phase 1, where it occurs, we have animal trials first. Sorry, you start out trying this out in animals. Now, once you assess that this vaccine will work in an animal, you have to apply for clinical trials, and the clinical trials are in 3 stages, or some persons say 4, and I'll explain why I say 4. And so in the stage 1 clinical trials, it's used in about 50 persons or so, where you're checking for the dose of the vaccine, the composition, the safety, the effectiveness, etc. If it is found to be safe and effective, then you apply to regulatory bodies, and the World Health Organization monitors a number of these to see whether or not you can move from phase 1 to phase 2, where phase 2 now will involve a larger group of persons, where you are again checking for the efficacy and safety. If it is found to be safe, then you apply for stage 3 clinical trials, where now you are testing this vaccine on thousands of persons, so that we can see whether or not it will be effective across certain age groups, certain sex, etc. Okay? And once the vaccine passes the phase 3 clinical trials, then they apply for emergency use authorization, where it can be used in the general public, where you continue to assess the efficacy and safety of the vaccines. And so when the vaccine is rolled out, for example, all these vaccines are being rolled out now, we still continue to look for adverse reaction, because although a vaccine might have gone through stage 1 to 3, when it's being used in the big population, you may still have some unknown adverse reaction. And so that is what's called the phase 4, where we still continue to monitor persons. So, for example, the CMO told you about the calls that she was making to persons, and most persons had mild symptoms. I told you that I woke up this morning feeling stronger than ever. Okay, so there are significant safety hurdles that have to be passed before a vaccine gets into your arm.
And I also wanted to add to Dr. Wilkinson's comments so far. For me, I was reassured to know that the Serum Institute of India produces over 90% of the vaccines utilized across the globe. And so for me, I was reassured because it means that that institute must be operating at a high standard in order to achieve that global market.
Good afternoon, everyone. So my first question is, what percentage of our population makes up the under 18 age group who will not be vaccinated or will not receive the vaccination currently under the Astrazeneca Oxford? I don't know how many young people fall within that category, so if they're not going to be vaccinated, what percentage of our population would then make up the herd immunity? That's the first question. And the second question I have is related to the recent press release on, I think, February 11th, where the CDC said that people who are fully vaccinated against coronavirus means persons who have received 2 doses of that. In the US, obviously, it's the Pfizer or the Moderna vaccine, can skip quarantine if exposed to someone infected with the virus, reported by the US Center for Disease and Prevention last Wednesday. I just wondered for us in St. Kitts, and given that this release recently came out since the US has been vaccinated, and I'm certain, obviously, I'm not obviously sharing something you would not have read. How do you see that translating to us in our tourism and driven economy? And how long do you estimate, if the US gets to that point and travel can be resumed based on what the CDC is saying, how long do you see us in St. Kitts using ourselves as some sort of gauge to indicate when do we feel we can get to a point where our country, our economy, our people who are in that particular sector can feel that there's some sort of relief coming? Because this was the vaccine that we needed as a lifeline. So those are the questions we get at the chamber continuously, and I couldn't sit here and not ask that question. Thank you.
Okay, I'll start with the second question. First of all, the Center of Disease Control is for the United States. The Center of Disease Control is not the World Health Organization. And although we look at what's happening in the world, in the USA, we don't necessarily have to follow all the guidelines that the CDC issue for the United States, because their situation is completely different to ours. For example, they have been having rampant community spread for quite some time. There was hardly any contact tracing, etc., because the disease was rampant within the community. So the containment measures they had in place would not have worked for us where we do not have community spread. We have also said that we have to strike a balance between lives and livelihood. And it is because we have done a good job in containing the virus and limiting community spread. Why, for example, the tourists want to come here. And we just need to hold strain a little longer until we get to herd immunity before we can make any significant changes in our protocols and procedures. Because the US plans to have their population immunized by the end of July. And once they get immunized and the cases drop to 0, they're going to change the rules, and they're going to be issuing advisories against countries if we have community spread. And so we need to take this into consideration. And that's why it's important. If we're going to be moving step by step with them, we need to make sure that we have a proper vaccine rollout and make sure that our persons are fully immunized so that we can open up to the world when the rest of the world is ready and safe to come here also. And so we can't sit here and give you any definite timelines, but from the reduction in diseases that are occurring around the world with the rollout of the vaccine, it looks like we'll be having a much better Christmas this year than we had last year.
Any more questions?
You asked another question, Mrs. Matthews, regarding the percentage of the population that's 18 years and under. I'm hoping there is somebody here from the statistics department that can give us this figure right off? About
27%.
Okay, so that's cool. All right, so we really need to try and achieve 70% or cover 70% of our population. And if we were to achieve that, we would be, doing very good in terms of reaching the herd immunity threshold. And somebody asked about the term herd immunity threshold and the term herd immunity. Basically, Dr. Wilkinson, there's a question. You want to just explain herd immunity?
Somebody else?
Yes, somebody else.
Okay, I realize that. Now, if you look at some of the movies with the animals in the jungle, let's say, for example, the elephants, when they're traveling with their young, if a lion is coming, the adult elephants form a circle around the more vulnerable baby ones in the center, and the herd protects them. And this concept came from animal studies. And basically, with herd immunity, we are saying that if we have a significant number of persons who are immunized, the chance of the virus spreading within the community is less. And so if, for example, every person who is working at the airport who are seeing tourists coming in, if they're immunized, even if someone was infected, they would not go home with the infection. If I am protected by the vaccination and I go home, the chance of me taking the virus home is significantly decreased. And we also know that there are some persons, little babies, the elderly, etc., who cannot be immunized. And so by you having more and more persons immunized, you have that protective shield around the vulnerable, the same way the elephants shield their young. Okay, and so that is the concept of herd immunity. And that's why everyone who can take the vaccine should take the vaccine, because you're not just protecting yourself, but the vulnerable.
Good evening all, Kenneth Francis. One question is, well, I heard Dr. Wilkinson said that you're also looking at the Johnson & Johnson vaccination. My question is how many different vaccinations would be used, or would you be just streamlining to 2 or 3? Because we know there are a number of trials going on, and you said about 6 are approved. So about how many, and what is the process you're going to be used to see which ones you would take and not take? I'm also interested to hear your take on the other cure that they're looking at, the ivermectin, I think it is. If you can say a little bit about that drug, please.
Okay, when I said we were looking at the Johnson & Johnson, I didn't necessarily mean Sinkits per se. We are talking about the World Health Organization, because a vaccine that is easily available, accessible, one that can be transported easily, one that requires 1 shot as opposed to 2, might be preferable when you're looking at mass vaccination. And so what I'm saying is that the Johnson & Johnson vaccine, although it is not, it doesn't have emergency use authorization as yet, it has a lot of promise. And so if this vaccine comes on board, we assume that that vaccine will take off also, okay? We have the Astrazeneca vaccine. We also have Pfizer and Moderna. The problem with the Pfizer and the Moderna, we said that it requires ultra cold storage. And so that is why the World Health Organization, through the COVAX facility, opted to go with the AstraZeneca vaccine. But countries around the world had the opportunity to give a checklist and see which one they more likely would use. But if, for example, we had the Pfizer vaccine and we were planning to use it in the 17 clinics around here, it means that we'll have to order 17 ultra cold storage freezers that go all the way down to -70. And these things cost thousands of dollars. And so you can see, from a practical point of view, it is better to go with a vaccine that is effective, safe, and that can be easily distributed to everyone, okay? And the drug that you're talking about has to do with treatment, okay? But we were able to contain the virus, and we are looking at protecting persons now through vaccination.
Okay, I just want to add, if we were to use the Pfizer-BioNTech vaccine, it would be a logistical challenge because yes, we do have negative 80-degree refrigerator capacity. However, it has to be thawed, transferred to the health center where it will be administered, and then there is only a short window within which you can use it. Once it's thawed, it has to be utilized within 3 to 5 days. If not, it has to be discarded. So logistically, it would be very challenging. I just wanted to add that.
And over 17 million persons in the UK have received the Astrazeneca vaccine.
Good afternoon. Anthony Evelyn, Nevis Building Contractors Association. Question, will the centers be open on Saturdays to accommodate construction workers? Number 2, will the team go through the villages to vaccinate those persons who would not be able to make it to the health center? I recall in my younger days, when vaccination time comes around, the nurses used to come around to the villages and meet the people on the side of the road, vaccinate them.
Well, I'll tell you what though, right? With a construction worker, if you were told that you had to go and pick up your check on a Friday afternoon, you will make the time if you had to go to Datebay to pick up your check. We have a vaccine that can save your life. And you have Monday, Tuesday, Wednesday, Thursday, Friday to get this vaccination. We have healthcare workers who are working around the clock, 7 days a week, doing a number of other things behind the scene. I believe that one can take the responsibility and find the time to go to the health center between those days. Banks don't open on Saturday and Sunday, and everybody find the time to go to a bank, okay? And so that's the simple answer to that question. But if it were that we had an overload and we had to work on Saturday and Sundays, we will, because all of us do, you know. Most of us in the healthcare field, we don't say TGIF because Friday is the same as Monday for us.
Another reason why we are utilizing a health facility for administration of the vaccine, it's because in case there are any untoward side effects, etc., you are already within a health facility, and whatever the issue is, it can be appropriately dealt with in that setting, as opposed to going on the roadside to vaccinate anyone.
Yeah, there are several questions online. I would like to pause and read. The first question says, there is a report that there is a squeeze on the provisions of the vaccine. Let me start again. There is a report that there is a squeeze on the provisions of the vaccines to CARICOM nations from the COVAX facility. How does this affect St. Kitts and Nevis? That's one. 2, here's a scenario. If a person gets both vaccinations, they travel for about 3 months. Then they wish to return to the island. How will they be handled? 14 days quarantine or full island access? I think this was answered before. Also, if someone took the vaccinations outside, would they have full access into the country, meaning no quarantine?
Well, I think the second questions, the last 2 questions, we answered them already, and so we're not going to repeat ourselves. I believe this is being recorded. Our persons can go back to the videotape and look at that.
In terms of the COVAX facility, there is no squeeze on CARICOM for the vaccines through the COVAX facility. The COVAX facility was set up to try to get equitable distribution of the vaccines throughout the world. We understood when going into the COVAX facility agreement that 20% of the population will be provided, or will be provided with enough vaccines to cover 20% of the population. That carries for every country, all 192 countries participating in COVAX facility. There's no country that's being treated differently from any other country. The idea of the facility is to ensure equitable distribution throughout the entire world.
Any other questions, please? Proceed to the mic, please.
Good afternoon. I'm Cynthia Cabrera from Salt Lake. I would like to know if someone that is traveling to St. Kitts and is doing the PCR test at a lab that is not certified with the CLIA and the ISO 17025, but if they do the RT-PCR test, if that will be valid to travel to the Federation.
Okay, so in terms of persons applying online the KNA travel form to enter the Federation, we are requesting that you do a reverse transcriptase polymerase chain reaction test at a reputable accredited laboratory. Well, let me just add, the sample that's taken should be a nasopharyngeal sample and not an oral sample, that's one. And it shouldn't be a rapid test. We are not accepting rapid tests.
Any further questions? If not, I want to thank everyone for joining this healthy discussion. I hope that it was fruitful. And for those who have joined us online, thank you for joining online and sharing your questions. Again, we want you to be ambassadors of the message to vaccinate and not hesitate so that we can reach this herd immunity threshold. I want to thank the honorable ministers from the federal cabinet who are present. I want to thank my colleagues, the members of the clergy, also the Chamber of Industry and Commerce, Trade and Labor Union representatives, and the Ross University for allowing us to use the facility. Let me take the opportunity now to invite Ms. Ophelia Blanchard to give the vote of thanks.
Good afternoon, everyone. Good afternoon, everyone here and those who are connected online. Mr. Chair, with the protocol having been established so clearly by your good self, it allows me to proceed immediately to express profound appreciation to all who have been participating in this significant forum. First, let me thank the chair, Mr. Abdias Samuel, for so ably guiding this afternoon's presentations, and for his opening remarks, which have set the tone for what has transpired here today and for what will be ongoing over the next few weeks with the ongoing campaign and sensitization. In addition, thank you for your leadership the COVID-19 task force over the past year. Sincere appreciation to Pastor Leroy Matthew for invoking God's presence, without which without which it would have not been possible for us to be here. We want to thank God for bringing us here together this evening and to be able to share and disseminate this information to you. As servants of the people, we have an obligation to gather as much information as possible that is available to us, present it in full disclosure as to the benefits and the side effects of the COVID-19 vaccine through traditional and social means. Today, we would have listened attentively to the presentations delivered by Dr. Cameron Wilkinson, Medical Chief of Staff, and Dr. Hazel Laws, Chief Medical Officer. And I believe that I speak for all of us who are privileged to listen and view their presentations, which outline the science and rationale for the vaccination and immunization process in this fight that now appears to be less insurmountable. Dr. Laws and Dr. Cameron Wilkinson, I wish to express our gratitude to your unflinching spirit and the meticulous way that you continue to perform your duties to a country, and please accept our appreciation for your team, the efforts, the work done under the leadership of Minister Akila Byron Nisbet and the members of the Ministry of Health. We want to thank the Honorable Minister Akila Byron Nisbet for her remarks, and the health professional team and the immunization committee for working assiduously to promote this drive. We also want to thank the Honorable Vincent Byron Jr., Attorney General, Mitigation Council Minister, and the co-chair of the Mitigation Council, Honorable Wendy Phipps, for their leadership with the COVID-19 Task Force. On behalf of the COVID-19 Task Force, I say thank you to all of you, members of the public sector, the private sector, the Chamber of Industry and Commerce, the Evangelical Association, the Christian Council, civil society, and all persons here and online for your presence and support and cooperation in this leg of our battle against the COVID-19 pandemic. We are grateful to the management and staff of the Ross University School of Veterinary Medicine, not only for affording us this venue for the meeting, but also for providing the live stream to extend reach to our stakeholders. We also thank them for their tangible support throughout the fight with this pandemic. Finally, but by no means least, we wish to thank and extend our profound gratitude to you, our stakeholders gathered here and online, for your participations, for your questions. And I trust that the responses that you would have received would have been very informative. Over the past year, the COVID-19 virus has plagued humanity globally, impacting lives and livelihood. Our response will determine our destiny. We must insist that taking the COVID-19 vaccine remains voluntary. It's a personal responsibility, thus leaving the people as God created us, free to determine the direction they will go based on the full disclosure of information on this matter. As you know, we are praying people, and let us ask God to give us wisdom to discern the information that has been presented to us today and will be presented to us via social media and different forms of media as we continue with the campaign. Let us ask for God's guidance to make the right decision for our health, our well-being, for our family, our friends, and our country as a whole. Thank you.
Again, thank you, Ophelia, for closing remarks. And with that said, safe journey to all. And remember, if you don't register, we will come and register you. Yeah? Thank you very much.
I will take the vaccine because building defenses against COVID-19 is a team effort, and we are all a key part of that defense.
I definitely will be taking the vaccine when it's my turn.
I will be taking the vaccine as it is an important tool in the fight against the pandemic.
It is important for me to vaccinate to ensure that if I do become infected with the disease, it can prevent hospitalization. In addition, it also helps with herd immunity.
I will take the vaccine to protect myself, my loved ones, my clients, my co-workers, my community.
St. Kitts and Nevis, why do we need to vaccinate? Kenisha? So we can jab COVID-19 away.
Today we're at the Newtown Health Center where we've had the official launch of the COVID-19 vaccination program. We are so pleased to have had quite a cross-section of individuals who were represented here today and taking the vaccine. We had members of the cabinet, we had persons from the medical fraternity, doctors and nurses alike, and we've had quite a number of other persons from the clergy, from immigration, from police, you name it, they were all here to take their first dose of the Astrazeneca COVID-19 vaccine. And so we all got our COVID-19 vaccination card to indicate that we would have taken our first dose of the vaccine. Once we come back in 10 weeks, we will have our second dose, and then once we got that second dose, then the cards would be stamped at the front with the Ministry of Health stamp, and that is to finalize that you did receive both doses of the COVID-19 vaccine. A reminder that the vaccine helps us to ensure that persons do not have severe illness or death. And so we're encouraging persons to step forward and take the vaccine. Get all the facts that you need to get. The Ministry of Health provides all of the information. The facts on the vaccine are on the covid19.gov.kn website. And so we're asking you and urging each and everyone to come out and get your vaccine. Look at the information, get all the information that you need, whatever makes you comfortable. But I can assure you that we have all taken it so far, and I'm feeling good. My arm is good. It was a vaccine, and so I'm excited about that. And so I'm looking forward to my second dose to say I'm completely vaccinated for COVID-19. And as the science continues to evolve, I'm sure we'll find more information and more benefits as to why you should take the COVID-19 vaccine. But for now, I know that since I've been vaccinated, I lower the risk of me getting severe illness or death from COVID-19. I also know that I'm protecting myself, my family, and my community. So I'm asking everyone, get the facts and then get the vax. Today was an example that it is safe, and we urge each and everyone, when it's your turn and your stage come around, to get vaccinated. As we progress, we will provide more information as to the next stage and who will be next. And so look out for that information from the Ministry of Health. We'll keep you informed, we'll keep you updated, we'll let you know how many persons have been vaccinated, and we'll let you know when it's your turn that you can make your appointment. Call in 311 or any of the health centers